Many thanks to the O'Brien Institute and the Institute of Health Economics for hosting this event today. And for each of you to take time out of your busy lives and your busy schedules to travel here and join us in this conversation. This is timely conversation and a crucial discussion that we need to have here in Alberta. Change is hard, but it's also necessary. So we're here today because while Alberta currently leads the country in eHealth innovation, we know that our health system still has much work to do. We need to create, and we haven't yet, a seamless, more effective, and a sustainable health care system. A future state that cannot be achieved without a more robust, provincial, integrated health information environment that supports the care team. So we care about our providers, we trust our providers, we need to support them. And the patient, regardless of the location, the time of day, the facility, and the healthcare provider. Dr. Rabi will have much more to say on this topic about an integrated shared health information record. What she has to say is important because it's in the next step in creating a more comprehensive exchange of patient-centered information within the care team, across the care continuum, and with the Albertan, to enable a stronger, more informed partnership between the patient and their care team, supporting shared decision-making. Information to inform health professionals to better respond during emergency and recovery services. Clinical analytics at the point of care, in the provincial systems, and in support of continuous learning. Quality improvement, health system planning, management, and research. And to seek to prevent unnecessary and potentially lethal overtreatment, complications, and delays. Due to information that is not being electronically charted, accessible by other care providers, when and where a person requires and seeks health care. Oh, I'm supposed to turn the page here. Okay. Four. Okay, so today we are creating a path of our next phase of evolution, and Dr. I'm sorry. And we're going to speak about the need for change. It speaks about the necessity and benefits of accessing and sharing health information between healthcare providers and to the information entered electronically once, collected from the patient at the point of care, and being available as appropriate through patient-centered, shared, integrated record. We are grateful for the leadership of Dr. Rabi and Mr. Belal Chami, who developed the discussion document, Engaging Providers in Healthcare Innovation. It is a product of research and collaboration with seasoned healthcare providers, professionals, as well as subject matter experts on the field. To give you a bit of background regarding the paper, in June 2016, Dr. Trevor Thiemann, Registrar of the CPSA, College of Physicians and Surgeons, raised a discussion at the Health Information Executive Committee regarding the need for providers to share and access patient information while delivering care. The Health Information Executive Committee, also fondly known as HIAC, is advisory to the Health Minister and is chaired by Dr. Amrine, our Deputy Minister. In July, in a working group under HIAC, was formed under the leadership of Dr. Thiemann, and he was there to guide the development of the white paper that Dr. Doreen Rabi offered to lead the research on. In December 2016, the paper was presented at both HIAC and the Health Information Data Governance Committee, another senior committee in the provincial environment that advises on the collection, use, storage, and standards of health information, which also supported, both of these committees supported this concept. They recognized the importance of moving forward in Alberta and in achieving the person-centered health information environment and the need for sharing that information with Albertans. It's why we're all here today. We all have a role, but this is why we're here today. So we work together, and this paper calls for action, asking each one of us to look at our own area of responsibility and influence and work together towards a common goal: health information that follows the patient on their journey through the health system and their lives, and is shared with healthcare providers when the treatment is needed. We owe it to the Albertans, and who expect to have quality health care, who expect that their healthcare providers have the information they need to provide informed care, and to use this information in partnership with them. Albertans should not have to tell their stories over and over again, or be overtreated because their health information was not looked at, was not shared, and that they themselves cannot access it. The road forward is not straightforward. We know that there are challenges and there are barriers, and we will stumble. We'll make a few mistakes, but at least we're moving forward. This task can only be accomplished with all of us together as vested stakeholders in this system, and at some point, maybe patients. Each of you have an important role, and I ask that you step up. Today, we need a commitment to start this journey. Today, I invite you to help us determine how we move forward and to be part of the solution and how you can contribute. There are no reasons strong enough to delay this discussion and to delay this momentum. It is really in the best interest of all of us that we do this. And we are ready. We have talent. We know what not to do. We've learned how to do some great things here in this province, and we can learn from others that you've heard from today, as well as across the country and the world. So as Dr. Amrine has mentioned, we are on an exciting path of change in a health system where Albertans can be invited to be an active partner in their own health and well-being. And we're sharing of health information will contribute to the continuum of care and of having the right information available to the right providers at the right time and the right place. Further benefit, and I think this is a significant benefit, I've heard many people share that with me, that the results are also a much more robust health information environment that will support our collective goals of continuous learning, quality improvement, practice evolution, making better, more informed decisions in health system planning and policy, and research that will contribute to making a much more resilient, effective, and sustainable healthcare system. I look forward to an exciting day with you. I want to hear from you. I want to hear from each other, and I thank you for your time.
Good morning. So I'm just going to forward to, there we go. So again, good morning. My name's Doreen Rabi, and I'm a clinical endocrinologist from Calgary, and it's my pleasure to be able to present our work in terms of this white paper, and I'm presenting on behalf of my colleague Bilal Chamali, who's hiding at the back of the room, but he provided wonderful policy mentorship as we wrote this paper, and without him, this paper would be not what it is. Before I begin, I should probably just give you guys some background regarding the lens I brought to this paper. Again, I'm a clinical endocrinologist, and so my clinical focus is diabetes care, so I do a lot of chronic disease management. I have to say that this was a wonderful professional experience, and I think the opportunity to engage in interprofessional dialogue on the importance of integrated health information, and also some of the concerns and cautions that we need to be mindful of as we go forward was really, really enriching, and I think led to hopefully a powerful document. So when we started this process of writing this paper, I think we all had a shared vision of what the potential of integrated health records could be for our province. And in committing these thoughts and ideas to paper, we wanted to basically have two overarching goals achieved. The first was we wanted to outline a roadmap from our current state of health information sharing to a future state, one of a comprehensive integrated health record. So creating that roadmap was one of our first goals. The second goal was to really create a framework for ongoing discussion and hopefully a document that could catalyze change in terms of bringing us forward in terms of an integrated health record. So those were our two broad overarching goals, and our specific objectives in writing this paper, and they're outlined in the paper, were one, to outline how digital health information sharing is central to the provision of quality care. The second objective was to outline and demonstrate that healthcare providers actually have a professional obligation to contribute to comprehensive health records. Our third objective was to provide recommendations to assist in the transition from a model of segregated health information to integrated health information paradigm. And fourth, again, was just to really reinforce the idea that this paper is something that we can all share, we can all discuss, and hopefully use it as something that binds us in this discussion and in this journey forward towards integrated healthcare. So we understand that everybody is coming to this discussion with their own particular point of view, their own professional experiences, and their own personal experiences in terms of health. And during this journey, there's going to be things that we agree upon and things where there might be points of tension. But hopefully at the end of all of this, and even at the end of this day, we can all have a common understanding on the centrality of good health information in the provision of quality health care. And the reason I think that this is something we can all agree on is that there's actually strong evidence, strong scientific and clinical evidence that supports the use of shared health information when it comes to providing health care. There's strong evidence that sharing information between patient and provider, between provider and provider, is something that's extraordinarily important in developing good therapeutic relationships. Further, the access to timely and accurate health information facilitates good clinical decision-making. We know through the open notes studies and through like studies where people have access to more integrated health records, that people make better decisions regarding their own health and regarding their patients' health. I think that what's come out very strongly in this morning's discussion already is the fact that by opening records to patients, we give them a fantastic opportunity to be informed and to be educated about their health, to be proactive in terms of making good health decisions, and really engage them in a very meaningful way in terms of their health care. As Dr. Zellmer pointed to, there's also emerging evidence that having open and integrated health records really does push us to a higher level and standard of care. We know that having access to integrated health records really does lead to better quality of care and also improved health outcomes for patients. And so with this evidence base behind us, we do have a vision for where we'd like to go in the province in terms of the integrated health record. And we're very fortunate, as has been mentioned earlier this morning, that Alberta is very lucky that we have a high state of e-readiness. We're already national leaders in terms of eHealth initiatives, and we have a lot of wonderful health information assets as it stands. We have a high uptake of electronic medical records in primary care, with about 90% of primary care physicians already using EMRs. We have very engaged pharmacists that are using the Pharmacy Information Network, so there's already broad information sharing regarding prescription medications within the province. And we also have Alberta NetCare. And as most of you likely know, Alberta NetCare is our provincial electronic health record. And how it's configured is that there are a number of provincial clinical information systems. These are information systems that contain information on diagnostic imaging, on laboratory information, hospital admission information, and there's a limited repository of consultant or specialist reports. And all of this information is organized under the Alberta Healthcare Number for individual patients, so that a number of authorized so that, again, sort of we look at when you, if you're an authorized care provider and have access to the NetCare portal, you can access information regarding your patient's interactions with hospitals, what their current prescription medications might be. You can find out what their most recent laboratory investigations are. And so you can have access to all of this information. So while this is a wonderful tool, and I think for all of us who have been providing care for more than 10 years will know that this is a wonderful evolution in terms of provision of care. Once upon a time, I was a internal medicine resident who would have to spend hours in the emergency department at 2 o'clock in the mornings trying to collect old charts from medical records, trying to, dig up faxes from a variety of different sites and try to integrate all this information so I could get a patient admitted. So now, thanks to NetCare, this has streamlined that process significantly, and our newer, younger residents are getting much more sleep than I ever did. But that aside, it is a wonderful resource, but it has its limitations. And just even from this diagram, you can sort of figure out what those limitations might be. One is that the clinical information systems are currently a little bit siloed, and they don't connect to one another. And the flow of information is pretty much from the clinical information system down to the provider. There's no connectivity between the providers. The providers can't revise these notes based on their interactions. And the other thing that's most notable is we don't see patients or families on this diagram. Now that is changing, and we are opening up NetCare to patients and their families, which is a very, very exciting evolution of NetCare. But it highlights again some of the limitations of NetCare in terms of how it's been. So our vision going forward of the integrated record looks something like this, where I think the most important thing to notice is that we do have patients and the family at the center of their care. And the other thing that I think you'd like to, or I think that we'd like to point out is even in this graphic, we have this vision of information being complete and encompassing all of the health issues of an individual patient. And I think what this graphic also nicely illustrates is that patients are going to have the most proximal interactions with their primary care team, and that may be their family physician, their pharmacist, a nurse care manager. And all of their personal information will flow to that immediate healthcare team. And then as they interact with the healthcare system, whether it be through specialist visits, hospital admissions, testing, their information will grow and again include all of that information as they interact with secondary and tertiary care providers. And then all of this care is provided in the context of the healthcare system. And the healthcare system will also have access to that information to do disease surveillance and health services use surveillance. And this is critically important to ensure that we have equitable health outcomes throughout the province and appropriate use of services throughout the province. And then lastly, this outer circle of the integrated health record is really a network of enabling and empowering policy and legislation to ensure, again, that we have that all of this health information exchange is done securely and appropriately and professionally. And so that's our vision. And so that's the goal we're striving towards. So when we sat down to start writing this paper, we had to figure out how do we navigate from where we are to where we want to go? How do we get from A to B? And there were a lot of practical, and then sort of there were some practical considerations that we initially needed to consider. And then as we got deeper and deeper into discussion, we realized that this is a very, very complex, multifaceted, multi-layered discussion. It's going to take some time, but we thought we'd identified the major issues and started to formulate recommendations on how we can address some of these issues. And again, some of the things that we realized up front that we just needed to address were that, first of all, to have an integrated health record in the province, we have to ensure that all providers have electronic records. Secondly, providers must be open to sharing these records with their patients and their colleagues. There must be an understanding of best practices in digital health, because as we open up these records and share this information that's been entrusted to us, we also have to have trust that our colleagues are going to use this information in a way that's best for our patients and the patients that we share. And again, I think that this has been raised already this morning in some questions, is there has to be a way to identify what is going to be shared information and what is sensitive information. Because I think that the thing that we really, really, really want to emphasize as we make this journey is that integrated health records need to be something that are empowering and enabling and ultimately are enriching in terms of the care experience, not only for patients but for providers. And the primacy of provider-patient relationships must never be forgotten. Those therapeutic alliances are critical. Those relationships are essential to a good care experience. And IHRs really need to continue to protect those, nurture them, and strengthen them. And lastly, we have to make sure that information technologies must be able to keep information secure and must be compliant with the Health Information Act. So those were sort of the key issues that we addressed, that we identified initially in our discussions as we developed the paper. And then as we discussed, as we were discussing these, we started to realize that there was going to be some challenges, but thankfully there's also some mitigating strategies that we can also consider as we move forward. And again, this first one is, which again has been raised already this morning, is this issue of confidentiality of information. And obviously as care providers, we take this extremely seriously, and we have legislation that outlines sort of the importance and the sacred nature of clinical information in terms of its right to being secured and private. And when we were talking about sort of this concept of confidentiality of information and what might compromise confidentiality, there was two things. There was the technical issues regarding the fact that information, if it's all digital, could potentially be hacked or compromised, and so there are these technical and analytic considerations that we need to be mindful of going forward. But perhaps the bigger thing that we need to be thinking of is again sort of what does a digital health paradigm mean for us as health professionals, and how are we going to behave? How are we going to coordinate our shared care of patients in a digital health paradigm? And so again, I think that there's a lot of discussion that needs to continue, and some of this will go on as we talk with specific provider groups regarding what their needs are, what their concerns are. But again, I think that we want to provide reassurance to the care providers in the room that as we move forward in this journey towards an integrated health record, that there is an understanding and appreciation of the importance of a very trusting relationship with your patients. And again, this is something that we want to enable and reinforce in an IHR paradigm, not something that we want to compromise. Information and information management overload. So again, this speaks to what Dr. Zelmer was brought up in her talk regarding sort of the concerns regarding workload and burnout. And certainly as we've gotten deeper and deeper and deeper into the use of electronic medical records, there's been more and more research that's come out regarding how that experience of working with an EMR may have benefits in terms of clinical outcomes, but may also have some potential harms in terms of the professional experience. And especially over the last 2 years in particular, there's been a lot of emerging evidence regarding how time spent doing EMR tasks is unfortunately very, very directly and literally associated with the risk of professional burnout. And so we have to be really mindful as we go to a digital health paradigm that we're very, very thoughtful about the burden this could place on providers and the potential burden it could also place on patients. Patients who may have varying degrees of readiness and willingness to engage in shared decision making and in terms of assuming responsibility for their care. But the way we thought we could frame this, and I think the way we should frame it, is that there is, as much as there's evidence regarding the potential harms that could come with a lot of electronically facilitated care, there's also strong evidence that, if we do this thoughtfully and carefully, paying good attention to how we design our systems, we can actually use the technology to facilitate the delivery of very, very good care, and actually use the technology to enhance the professional and personal experience of delivering and receiving care. So these are hurdles that we think that we can deal with in terms of mindful and thoughtful, intelligent design. And for patients, I think we have to first of all talk to patients and find out what are their expectations, what role do they want to play, and digital health gives us a wonderful opportunity to really personalize the care experience for our patients. And And I don't think that we should be making broad brush strokes about what patients, can or should or be willing to do. We need to make those decisions individually with our patients, and we need to speak with our patient community to find out how best to potentially address burdens that they might perceive when given more access to their information. But at the same time, there's a lot of reassuring research that suggests that these are fears that may be unfounded, that the more access we give to our patients, the more proactive they can be in terms of making good, healthy choices, the more engaged they can be in conversations regarding their health, the better able they will be to clarify potential mistakes or discrepancies within their own health record. And ultimately, again, the research would suggest that the more access to health information patients have, the more access to their providers that they have digitally, the better their outcomes in terms of many chronic disease states. So again, I think that this is something that we have to start talking to our patients about, but I think that we have to be very, very, very cautious about assuming that we're going to be overwhelming patients by opening this door. And again, I think we need to embrace the engagement and educational opportunities that integrated health records might offer. And so, and the other thing that we're very, very mindful of as drafting this paper is that ultimately, in moving towards an integrated health record, it's going to be critical that all stakeholders have confidence in the value of the IHR and the security of the IHR, and we need to ensure that everybody is engaged going forward in terms of how to design this, how to structure it, what are our priorities in terms of, again, what paths are we going to take first, what are we going to prioritize. And I think that the more dialogue, the more discussion that we have, the better the product's going to be at the end of the day. So, finally, in the white paper ends with a series of recommendations. I think we have 21 recommendations in total that are all categorized under 4 major themes. The first is under provider engagement, and we'll be discussing more of those later in the day with individual provider groups, because again, I think we want to be very, very mindful of the fact that we're all coming to this discussion with a slightly different lens, a slightly different experience behind us. All of those perspectives and experiences are valuable, and we can leverage those into creating a really quality record, and we want an opportunity to hear and use that information to our collective advantage. Citizen engagement is the other key piece. We need to talk to our citizens, we need to talk to our patients to find out, again, sort of how we can ensure that this integrated health record ultimately achieves the goal that we want in terms of a healthier province and a greater state of wellness in our society. The other recommendations fall under the categories of ensuring a safe environment, and this involves both some technical and some policy considerations, and then technical and analytic considerations, which speaks more to some recommendations that we're making regarding secondary data usage, again, sort of how the health system might be able to thoughtfully, carefully, and systematically review collected health data to ensure that care across the province is high quality, that it's equitable, and that we're really ensuring the best outcomes for our patients and minimizing unnecessary utilization of the the health service system, and eliminating potential harms to all Albertans. And that concludes my portion of this morning's talk. And I'd just like to acknowledge all of the individuals at the Health Information Executive Committee that provided input to the writing of this paper, and again, sort of the interprofessional dialogue we had in the months from the very, very short interval from August to December were incredible. It was, as I said, I think it led to a very, very rich document. And again, I thank you for the opportunity to speak this morning.